Good afternoon. I want to welcome everyone who's watching on social media and all those listening live through BBC Radio Jersey and Channel 103. My thanks to them for broadcasting this press conference and to all the media who are including this announcement in their reports. I'm joined today by the Deputy Chief Minister, Senator Lyndon Farnham, by the Minister for Health and Social Services, Deputy Richard Renniff, and shortly the Medical Director, Mr Patrick Armstrong. Last week, I committed to providing islanders and businesses with our plans for a phased and gradual safe exit from the current lockdown restrictions in Jersey. I need to be clear that we have a long way to go, and living with coronavirus will be a feature of our lives for some time to come. But today, I'm going to give details about how we expect to move towards a safe exit. So from the outset, the Government of Jersey has pursued a delay, contain and shield strategy to combat the COVID-19 pandemic. The primary goal of this strategy has been to flatten the epidemic curve, and this has allowed us to protect vulnerable islanders and save lives by making sure those requiring acute care don't all need access to it at the same time. By working together as an island community and by following the stay-at-home guidance, we have successfully suppressed the spread of COVID-19 to date, creating vital time for health and care services to prepare for the increase in infections that will inevitably still come. And we've used this time to enhance our testing regime, as I alluded to earlier in the week, to procure substantial supplies of PPE and health equipment, and to construct the Nightingale Hospital at Millbrook. The response of islanders has been nothing short of excellent. Because of your cooperation, your responsibility and your community spirit, we've seen the epidemic curve flattened, the number of cases significantly contained, and a network of volunteers established to support our most vulnerable for when we will need them most. Thank you, and thank you for the many sacrifices that you have made. You should be incredibly proud of the way you've acted to protect our island and our community. It may be hard for some to imagine, but the lockdown measures introduced in Jersey have actually been less extreme than in some other jurisdictions, but they've still significantly impacted our daily lives, education, and businesses. Now islanders and businesses want life to get back to normal. But let's be clear. Life isn't going to be anything like normal for a long time. It will still take many weeks for us to adjust to life with COVID-19. But we will adjust, and we need to start to unlock. We are an island that has built success on being agile and adaptable. We've done so before, and we can do so again. Coronavirus is part of our lives now, and the island will need to incorporate preventative measures for some time, at least until a vaccine is ready. However, our public health monitoring indicates that we can begin the careful process of relaxing the lockdown measures that are currently in place. We are in a strong position. Our level of new daily cases is currently low, and that's clear from the rate of new reported cases and the rate of admissions into the General Hospital. However, it is also likely that the majority of people in Jersey have not yet had COVID-19. So when we begin to relax lockdown measures, this will mean more people will come into contact with friends, neighbours and colleagues from outside their households. Infection rates will rise steadily, and more people will contract the virus, and some of those will need hospital or intensive care. And that is why it is absolutely essential that we follow a careful, staged approach to lifting lockdown measures. Now, the Minister for Health and Social Services will set out the detail of that staged process, which will follow 3 distinct levels. And the Deputy Chief Minister will talk about what this means for island businesses. I want to emphasise at the outset that this will be a gradual process. As we move into a new level, we will not necessarily implement all measures in that level on day one. We must all be patient and responsible. If we fail to do so, we risk a surge in COVID-19 infections. We risk exposing vulnerable islanders to harm, and potentially that would mean needing to return to lockdown. And now I'm going to ask the Minister for Health and Social Services to talk about the detail of the framework. Richard.
Thank you, Chief Minister. An effective vaccine for COVID-19 is unlikely to be available for some time, but we cannot stay locked down indefinitely. To do so would have an extremely detrimental effect on islanders' mental and physical health and well-being, as well as severely impacting our economy, which of course supports our health, our education and welfare services. So we are proposing to lessen the restrictions in a safe and controlled way. Firstly, we will scale down our delay measures, including the stay-at-home instruction and school closures, across 3 carefully calibrated levels. This will take many weeks and will be done in carefully managed ways. It will be gradual and it will remain under constant review. Secondly, we're stepping up our contain measures. We are increasing our monitoring of the virus so we can quickly identify when new cases and clusters appear. We're significantly increasing our testing capacity, and we're growing our contact tracing team to help control the spread when positive cases are identified. And thirdly, we'll step up our well-being support for the extremely vulnerable. The health service will continue to provide them with information and support, enabling them to make right choices about how to cope and live as the pandemic progresses. Scaling down our delay measures will allow greater personal freedom for the majority of islanders and will incrementally remove the lockdown, which has become such a distinctive part of our lives in recent weeks. We've set out a detailed safe exit framework to ensure that islanders can understand how this will happen and what changes are anticipated in each of the 3 levels. I must stress that progress through these levels will be informed by expert medical advice to minimise the risk of unnecessary harm so that we can balance the suppression of the virus with islanders' wider well-being, and all the while ensuring that we have enough healthcare capacity to manage an increase in cases. Undoubtedly, we will see an increase because that is a consequence of greater movement of people. That will mean more people in hospital and sadly likely to mean an increase in the number of deaths. The framework has been developed by looking at public health guidance issued by the World Health Organization, evidence from other leading health organizations, and the plans published by other jurisdictions. It's like a map, and that means we have to go on a journey together to reach our destination. We cannot and we must not simply lift all the restrictions in one single go. It's also not necessarily a one-way journey. Our progress must be balanced and conditional in order to avoid overloading our health and care services. If we see cases increase too quickly, we will need to rapidly introduce further restrictions. I want to stress that the observance of the measures and the cooperation of islanders is critical. If we become complacent, then there's a greater risk of going back to tougher restrictions, as we have seen in other jurisdictions. Exactly when we move through the levels and when changes take place within each level will depend on how quickly and how far our monitoring tells us COVID-19 is spreading through the island, and how much pressure key health and care services are under. We are currently in level 4 lockdown with strict social distancing and the stay-at-home order in place. Social distancing will remain a critically important measure in all subsequent levels. We're going to use the term physical distancing in future as we think it's easier to understand. We want people to be able to enjoy social interaction, but while maintaining that 2-metre physical distance. Level 3 will be a soft lockdown. The stay-home order will be lifted and some businesses will be able to operate. However, off-island travel will remain tightly limited and schools will remain closed to begin with. In level 2, which we are calling soft opening, more businesses with evidence mitigation plans and appropriate distancing could reopen, alongside many community services. We anticipate people will begin to be able to travel off island again, as and when commercial travel services become available. It is likely, however, that they would still need to self-isolate for 14 days upon return should they travel. Finally, we will reach level 1, physical distancing. This is what many have referred to as the new normal. People will be able to gather again in private homes, and most venues will be permitted to opening with strict social distancing and hygiene measures in place. Even though we have 4 levels, we will be looking to move through them at a measured pace, and not all the activity within any specific level will be introduced on the first day of each stage. The proposed details of each level will be made available on our website following this press conference, as well as through the media. While we progress through the levels, we must remember that there are still people in our community, both adults and children, who have health conditions that put them at very high risk of severe illness from COVID-19. These people are extremely vulnerable to the virus. During the lockdown period, the government has strongly advised the extremely vulnerable to avoid as much social contact as they can, and in fact not leave home at all. This advice remains in place, and shielding them at home must continue. When we begin our journey to ease restrictions, please always consider these members of our community. It is our duty to protect them by continuing to carefully follow the guidance that is in place. I will now hand over to the Deputy Chief Minister.
Thank you, Richard. The question I know many islanders are asking is, when will we have more freedom and when will more businesses be able to open? In advance, it is impossible to be certain exactly how COVID-19 will spread through our community. But we do want to provide as much certainty as we possibly can. The framework being announced today provides a clear plan of the levels we will go through. There are 2 key indicators that will signal that Jersey is ready to move safely from one level into the next. Firstly, evidence that the number of new COVID-19 cases is either rising gradually, is steady, or is declining. And second, evidence that there is sufficient health system resource and capacity. The current lockdown order expires on the 11th of May, and we expect to begin to moving to level 3 of the framework from the 12th of May. And this will, of course, be subject to the advice of the scientific and technical advice team, who are monitoring the situation closely. In level 3, the stay-at-home order will be lifted, and there will be no general restriction on the time spent outside the home. You will be able to meet outdoors in groups of up to 5 as long as strict physical distancing is observed at all times. During level 3, restaurants, cafes and other food establishments are able to offer an outdoor seated food service in a way that is physically distanced and with excellent hygiene measures in place. Beverages can be sold with food, but outdoor drinking only service will not be permitted at this stage. Pubs and bars able to offer socially distanced outdoor seating service will be able to operate as long as they offer meals. Strict social distancing and hygiene measures will be required for staff both inside and outside, as well as for customers. Shops will begin to open subject to strict physical distancing and hygiene guidelines as well. And businesses can begin to allow some staff to return to work in indoor offices and workplaces in a staged way, but cannot offer any services that involve close personal contact. In levels 2 and 1, as more business activity is permitted, we will also ask businesses and other employers to apply tailored public health guidelines to protect their staff and their customers. We will also work with industry groups and trades unions to assist businesses and staff to make the necessary preparations before we move into each level of the framework. We cannot give clarity yet on the date when we will move into level 2, but we hope to provide that information with as much advance notice as possible to give islanders and businesses time to prepare. Our testing and monitoring programme will continue to be enhanced throughout May so that we have the evidence and the advice needed to move carefully through level 3 and into level 2. Health and well-being are linked to a strong economy. Keeping people in work with secure livelihoods and financial stability is very important for our mental and physical health. That is why it is vitally important to get our economy moving again as quickly as possible. And as we gradually introduce these measures, which will ensure that we can restart our economic recovery with confidence. Thank you. I'll now hand you back to the Chief Minister.
Thanks, Vincent. I hope that this provides islanders and businesses with clarity on the path that the government aims to follow in the coming weeks and months to gradually reduce restrictions. And we will, of course, use medical evidence and scientific data to help decide when we are ready to move to the next level. We remain in level 4, the current lockdown. However, we recognise that there is an unequal impact of the lockdown across our community. Those who live alone or in cramped conditions suffer more from the stay-at-home restrictions. So I'm announcing some practical changes to the current lockdown instruction to be effective from tomorrow, Saturday the 2nd of May. So from tomorrow, islanders are still encouraged to spend most of their time at home. However, we want everyone to be able to take care of their well-being. So from tomorrow, you will be able to spend up to 4 hours a day away from your home rather than 2. And this will be necessary for necessary shopping, medical reasons, or any activity out of your home. So previously, time spent was for exercise only, and this change will allow you to spend more time in any activity or pastime that takes place out of home. And we also recognise that social contact is important, and so you will be able to spend time outdoors with members of your own household, as now, and with up to 2 people you don't live with. But please remember to keep 2 metres between you and anyone you don't live with. We want you to be able to have more social contact, but to keep you and them safe while you do so. Now, these changes don't lift the lockdown, but they should make it coping with it fractionally easier until we move to the next level, which we currently anticipate will start to happen on Tuesday the 12th of May. As I've said, exiting safely from COVID-19 is likely to be a journey that takes a number of months, and we will progress more safely towards a full exit if we continue to work together. If we fail to act as a community, then we risk an unacceptable increase in cases with more stress put on our hospital. And in those circumstances, we would actually need to reimpose restrictions. And that's not a position I want us to be in, but it requires all of us to continue to act responsibly. So a staged approach to increasing social contact is critical in helping us manage infection rates and to avoid overwhelming our health and care services. Please listen out for and continue to follow public health guidance at all times. And in order to monitor the situation, we will increase the testing of coronavirus, as I've already announced. We'll also continue to publish all key monitoring data regularly and rapidly so that both progress along the framework and any obstacles are transparent and widely understood by everyone. Now, before we take questions, I want to thank you again for your patience, resolve and cooperation over the past few weeks. It has allowed us to reach a stage where we can begin to restore the freedoms that I know all islanders want to enjoy once more. Now, while we look forward to this, we must never forget the risk that COVID-19 does still pose for our community and the impact it has already had, and sadly had, on 24 families who've lost loved ones as a result of the virus. So please continue to act responsibly while we enter this extended bank holiday period. Follow the updated stay-at-home instructions and maintain the good practices you've already put in place. And that's washing your hands for 20 seconds regularly throughout the day. Catch your cough or sneeze in a tissue, bin it and wash your hands. If you don't have a tissue, cough into your elbow and avoid touching your face. And clean and disinfect objects and surfaces. Now separately, as I've said earlier this week, if you are concerned about your physical health, even if not COVID-19 related, please seek medical advice as soon as possible, especially if you're suffering from new or unexplained symptoms. And I personally find it very concerning that there are members of our community of all ages with serious underlying health conditions who've already been in the confines of their own homes for some weeks, and some alone. I have a heavy heart for those who endured the occupation but cannot celebrate 75 years of liberation next week in the way they had looked forward to. If you are in that position and are struggling in any way with these continued restrictions, you should not think that the brave thing to do is get on with it or suffer in silence. We will get through this as a community, and that means that if you need support, you are helping your community. You are showing courage by asking for help yourself. And there are people out there who want to help, but they just need to know. Finally, as we enter a week celebrating our liberation 75 years ago, please let us remember and draw strength from the generation of islanders who faced unprecedented adversity during the occupation. Jersey came through that terrible period as an island by people supporting one another and working as a community, even in the face of seemingly insurmountable odds. That is the Jersey spirit, and it is the same spirit that you all have shown over the last few weeks, and I'm certain will continue to show throughout this pandemic. Thank you for listening, and we'll now start doing some questions. So just to deal with some of the admin, for people who listened before, this will be familiar. We have 5 journalists on a screen, which is from my angle to my right, over that direction. And for ITV, we have Gary Burgess. For the JEP, we have Tom Innes. For Bailiwick Express, we have Elodie Raduls. BBC, Julie Flanagan. And 103, Harry Booth. And we'll do, I should actually just apologise as well. I had originally anticipated and arranged for Mr. Patrick Armstrong to be present with us. So actually we could handle some of the operational medical issue questions you're all wishing to put. And as you will have heard from the beginning of my words today, statement, he was due to be with us. And literally I've just been informed during the course of the discussions that he's actually engaged on a medical matter and is therefore unable to join us, which kind of does illustrate the issues that we do face about, obviously, a lot of the medical people who are doing it are still operational as well. So I apologise for that, but obviously it's for very, very good reasons and ones that I hope we would all understand. What we will try and do is obviously make arrangements for either the next press conference or the one after to try and get someone medical in front of you. Right, so what we will do then is, I think, go through 2 questions each per journalist, and either they'll be for me or we'll hand them over to either Lyndon or Richard. So, and we'll go in the order I've read out. So, Gary, you're first up from ITV. First question.
Chief Minister, thank you. Well, actually, if I can be dead cheeky and just pose one question to each of you. Chief Minister, I asked our viewers today what questions I should ask, and perhaps surprisingly, the most common one was, when will I be able to hug my parents or my grandparents or my children or my grandchildren? We see an hour ago, Guernsey announced social bubbles where 2 households can buddy up exclusively and be treated in effect as one household. Why don't we do the same? To Senator Farnham, if businesses from the 12th of May can start opening for outdoor seating, are you not risking actually causing more unintentional social gathering? How do you balance that health versus economy question? And Health Minister Boris Johnson has said the UK is past its peak. Is Jersey? We've heard a lot in the UK about the R number, that reinfection rate. We need it to be below 1. What's the R rate in Jersey? Thank you to the three of you.
Do you want to do? Shall we take them in as he's posed them?
Yes.
Yeah. Okay. So you do the R and I'll do that. Right. So Gary. Okay. Sorry, I was trying to see whether the first question was actually more for the Health Minister rather than me. But I think the difficulty we are all facing, and I make the point that we're trying not to compare ourselves with any jurisdiction. I'm sure they're not trying to do the same to us, but we're trying to learn from all the jurisdictions, and it's all about we as individual islands or jurisdictions are relative to our own curve. And so in terms of within one's own household, we haven't been saying to socially we're moving on to physically distance, obviously, but to distance from ourselves within the household. It's just about as we expand outwards, and this is the initial thing that we've announced with effect from tomorrow, is the ability to meet 2 extra people, and that is with a recognition that it may well be grandparents, for example, who are in there, but that is mainly focused on outside, and it is mainly respecting that 2-metre distance. Because for all the reasons we've rehearsed, although we are in a good place as of today, learning from other jurisdictions and also looking at our profiling, that wave or that curve is still out there. The virus is still present on the island, and it does still pick on vulnerable people, and that's the whole balance we've got to deal with this really awful scenario. So I can't give an answer to when for people outside the household, and we are looking at the definition around vulnerable if you look on the guidance that we're putting out on level 3, but for the moment I can't give any more comfort on that, but at least we are starting to bring in the measures that say actually you can now see them, but just keep your distance, and obviously within the household you can hug your children.
Minister,
we completely lost your sound on that bit, Gary. Sorry.
No, not at all. Yeah. Could I just ask, can you give people some hope? It is literally about being able to hug grandparents and grandchildren. Would you at least consider the Guernsey social bubble approach? Would you investigate that?
I think what we're going to do, we are looking at this definition around vulnerability and how that applies. So I'll say that. I wouldn't want to give a false promise yet. Everything we do is around the medical advice that we receive, and obviously now from the wonderfully named scientific and technical advisory, a cell actually, but it's called a stack, and all of that sort of information and advice comes from it. Now they will look, so I think it's not only Guernsey, I think there are other jurisdictions who've looked at this kind of concept. Let's just wait for the advice. Richard.
So, Gary, I think you asked me whether we had seen a peak with reference to the Prime Minister's comment. And, of course, the truth is in Jersey we haven't really seen a peak. We've seen a few rises, but nothing I would describe as a mountain peak. But that doesn't mean to say that there is no longer a risk of a surge which might take us up to a peak. So that is why we must be careful. The reason we haven't seen a peak is because islanders have been absolutely wonderful in understanding the need for a restriction in their personal and social lives, which has allowed the island to prepare, and specifically our hospital, to prepare itself for the spread of the virus. And we're in a good position. But as we unlock, there will be more movement around the island that will spread the virus, because that's what the virus loves. It just loves moving about amongst people. So we will see more infection. And it won't be surprising that we see a build-up. Now, we've got to carefully gauge whether we are rising to a peak that is unacceptable. And if we are advised and we feel that the restrictions have been relaxed too quickly and we're putting people in danger, then it may be necessary to scale back on some of the activities that are presently permitted. So it's a very difficult exercise that will need constant vigilance and measurement. On the question of hugging, I do understand how wonderful it is to be in families, but the advice is at the moment grandparents are amongst the most vulnerable people. Now we are considering exactly what guidance to give to those people, because our older generation, and I'm approaching it, but the older generation have come through so much, and very often we can trust them to be the best guide of what is best for them. They understand their health risks and the problems they face. But we do want to point out that because of their vulnerability, we are presently saying they should keep, and everyone should keep, that physical distancing. And we'll always keep it under review, is what I can say. Thank you.
And of the R rate, Health Minister?
Oh, the R rate is of course extremely low in the island because the infection is not yet spreading. But we will see as we begin the testing how much infection is in the island. That is the surveillance testing we're undertaking beginning this weekend. So as we do open up the restrictions, we can expect the R rate will increase. There will be greater spread amongst people. We haven't seen it yet. Thank you.
Thank you, Gary. As we move into the soft lockdown and then the soft opening stages, the view is that if business can operate safely and in line with strict guidelines and observe the social distancing to protect their customers and staff, then they should be able to do so. And I'd like to see some more consistency in that. Right now we allow a number of essential retail, as we call it, to open, including food stores, some of them large and small. Yet we have large department stores and other stores that have remained closed. And actually safe physical distancing would be as able, if not more able, to happen in those shops that are shut. The same stands for al fresco eating areas. Now we have many different types of those around the island, in town, on beaches, in the country, and we know that the virus doesn't spread so easily outdoors. And in many of those al fresco areas, there's plenty of room to provide good distances between tables, so families and friends can go out and enjoy a meal together as the weather gets warmer. But I'd like to stress that it's the top priority, of course, of the economy team to get our economy moving as quickly and as safely as possible.
Okay, right. I think on the basis that Gary managed to get one question to every minister, if we want to follow that feed and then see what time we end up in. So, Tom, 3 questions, and from the JP.
Good afternoon, ministers. We just heard from the health minister that the R rate in Jersey is low. It's not, the infection is not yet spreading, he told us. Is the other reason for it being low at this stage is that it's not known, and there was no figure put on it, unlike in Guernsey earlier where it was given, because of the lack of testing? And is greater testing going to be, is it going to come in this time? We've been told repeatedly about the levels of testing that are being offered by the government, and the government has fallen repeatedly short of these levels. Can islanders now trust those involved to hit those numbers of targets rather than fall short of them?
Who's that addressed to? Is that to Richard or to myself?
I was leaving it to you as to who was felt best able.
Okay, thanks. Richard, do you want to take that?
Yes, happily. Yes, it is true. Testing it will be the most accurate measure of how far the infection has spread, but we are able to use other data at the moment, such as the testing that is taking place, the hospital admissions, and the household survey that is being undertaken. But testing will begin tomorrow. That is the serology testing, or the pinprick of blood that will be taken. A number of households have been invited to attend the testing centre and participate in that as a statistical sample of the island. And once those results come in, we will have a scientific statistical figure of how the infection has spread throughout the island. So all the time we are gathering improved data.
Just pick up actually on your early comment, Tom, which was about the capacity side. And the issue we've always faced is that the testing, there was a capacity cap, if you like, from the off-island testing that we had a constraint by. And we also had a constraint, like many jurisdictions, around certain supplies that came in. So at one point on number of swabs and things like that. That's all been elements that, to an extent, have been not directly under our control, and we've acted as swiftly as we can to deal with those. But don't forget, there's not that many places who've actually got antibody testing ready to go. We are starting tomorrow. We've secured, obviously through your good officers, actually, or your organisation, or one of your colleagues' good officers, 50,000 from one supply. We are waiting for another delivery of another 50,000. But the fact is that we are starting that testing tomorrow, and that will then give us some really good data, we believe, should be a positive, bearing in mind where we believe we are in the profile of this disease through the island. We are still at relatively early stages relative to the curve. Anyway, sorry, I'll just reinforce that point. So what's your second question?
The question of trust is obviously very important in the from islanders to the government in the response to this. There have been concerns that I've expressed previously about the number of tests being stated at a certain level and falling short of that. You've accounted for some of the reasons there. We've had a potential other issue in the last 24 hours about the leak of information, which is also going to impact on trust. Could you try and reassure islanders about the why the government's response is something that they should trust in?
I'll deal with the leak and then I'll deal with government, if that's okay. So on the leak, I think there has been a statement earlier today. We've had, in fact, technically there have been two leaks. There's been one which I believe a statement's been issued on. It will be a matter of disciplinary process. And therefore, on that basis, I assume you would understand that I can't comment any further at this stage. The other one, I've instructed the Chief Executive to continue his investigations, and I expect him to report back to me on the findings of those investigations, and then we'll proceed. So that's really all we can talk about the leaks. In terms of trust in the government, I'm never going to start going to the trust about whether people trust politicians or not, or even whether people trust journalists or not. However, what I would hope is that they do trust the medical advice that we act on. I would hope they trust the outcomes of what they've seen so far. In other words, as I said, if you go back to the beginning of this, which even though it feels a long time ago, is not actually that long ago, and what has happened in every other jurisdiction, and actually over here, to date, and we always remain cautious, to date we are in a very good position. We've taken decisions at the right time, to date, and we've got the island in a place where we've bought time and we continue to prepare. We believe our preparations are at a very good state. Next question.
I in some ways hesitate to mention something that's being done in Guernsey, as it seems perhaps that makes it less likely that it'll be done in Jersey. But we did hear from the sister island earlier that the public will be allowed to contribute to these sessions by asking questions. Will there be any prospect of islanders doing that for future conferences in Jersey?
I think both Jersey and Guernsey never hesitate to learn off each other when we think it's the right thing to do. And I can see no reason why we shouldn't be able to do that at some point. I did do was actually a while ago now, I did do a Twitter thing where we did answer quite a lot of questions from people. I'm acutely aware we need to get some more into that. Gary has managed to bring in some questions from the public anyway, but no, I'm sure we can arrange that at some point. I remain the focus is always this balance between getting the communications out, as you say, communicating with the public and trying to answer some of their questions. We do get quite a few in. Don't forget, we do have the helpline that's handling a lot of the queries, but also in making sure our preparedness is as best as it possibly can be, and continue to run the island on the other matters that always come across our desk. Okay, those are your three. Elodie Bailiwick.
Yes, thank you. Good afternoon, and thank you for taking the time. I don't know who's best placed to answer this one, because both you, Chief Minister, and Health Minister, have mentioned this before, but you both said in your statements earlier that if cases rise again, stricter measures might return. What are the specific health trigger points for returning to lockdown? Is there a specific number of cases, for example, or of hospital beds being taken?
I mean, maybe the way to do it, should we do the three, whatever, have you got two other questions? We can then split them up between the ministers?
Yes. So my other question was probably for the Health Minister. It's about antibody tests, which you've mentioned before will be used to influence the exit strategy. We previously asked for the name of the provider of the original 150,000 antibody test kits ordered by the government, but it has not been disclosed. Would you be able to say why the name hasn't been released, and are the tests still going to be used, and if not, why? And my final question was for Senator Farnham. You mentioned on Wednesday you would consider all steps available to government against Jersey Gas, including legal powers, in light of price rises. Has the government been planning a scenario for a takeover of Jersey Gas? And if not, what other powers under the Jersey Gas law are being considered for use?
Okay, shall I, for convenience, shall I let Linda, do you want to have that last question for you?
Yes, okay.
And then Richard and I will arm wrestle as to which question we divvy up between each other.
Okay, thank you. Thank you, Elodie, and I can first report that we continued discussions with Jersey Gas this morning, and I felt they were productive. There's no plan to take over Jersey Gas. Jersey Gas are, as a utility, are excluded from the phase 2 of the payroll scheme. That sector utilities are excluded. But we do have a separate recovery fund. That fund is to deal with situations and the challenges such as Jersey Gas face. We have asked for further information. We've seen Jersey Gas's accounts. We'd like to see the parent company's accounts and the to understand their financial position. We made that clear this morning. We've confirmed exactly what further information we require, and we await for their response. I'm reluctant to say any more at this stage, other than both sides are looking for a solution that helps Jersey Gas's customers and Jersey Gas, if necessary, because they are an important part of our utility infrastructure through this.
Okay, Richard will take the question on the trigger points, and I'll try and deal with your first question. So, Richard?
Yes, Elodie, I think you were asking about whether there are any thresholds within the health system which would automatically mean we start dialing down on the measures again. And no, it's much more nuanced than that, because it will depend on all sorts of factors. So, for example, if there are significant numbers of people in intensive care, then that means there's a significant amount of the workforce are dealing with those patients. It is very labour intensive. So that might mean pressures in the hospital. But whereas if many of the patients were hospitalised but not necessarily in intensive care, you might have the same numbers in hospital, but there'd be fewer pressures. So therefore we can't give a specific number. It also depends on cases in the community. How our GPs and other resources are being used in the community. Are they stretched, or are they still available? It'll also depend on the numbers of staff available, because if the infection does spread, some of our staff may become ill, at what sort of levels. So it's something that is carefully considered day by day as to how we can best respond. I hope that answers your question.
Okay, it's a fairly short answer actually on your first question, which is I'm not aware of any reason why it hasn't been released. I thought it had been. So I'll go back and follow up. Unless there's some obscure commercial reason that I'm not aware of, I'll make sure it gets to you as soon as I can. Okay. So, right. BBC, Julie.
Hello, can you hear me all right?
Yes, we can.
Oh, good. Thank you, Ministers, for giving us this opportunity to speak to you today. It's great to hear that there is going to be a softer phased introduction of businesses opening. What about services, essential services such as dentistry? When can we expect those surgeries to open?
One for you, Richard.
Yes, I'll try.
Okay.
Mm-hmm.
Okay, do you want to give us the other two questions and we can, as I said, divvy them up?
Yes. In terms of people who may be vulnerable and who may be living by themselves, what extra work has been done to make sure that they don't fall between two stools, and to make sure that they aren't overlooked? Also, in the UK, the Nightingale hospitals were officially opened by the likes of Prince William and Prince Charles via video link. Can we expect something similar here in Jersey? And if so, who will we hear from?
Okay, Richard, are you able to take the first two? In terms of that's the vulnerable and the...
Yes, I will attempt. Yes.
Okay, and I'll do the last one.
Okay. So dentistry, of course, the risk there is that it is a procedure which involves droplets of moisture, which might cause infection. So it is a highly risky activity and needs careful thought about how to re-engage with dentists. And there has been throughout many weeks really a constant dialogue with dentists, because they do want to open up again in a safe way, and we are working with them to establish safe ways in which dental surgeries might open. But meanwhile, there are dental services available in our urgent treatment centre, and some of the island's dentists are working there. So anyone with a serious dental problem can attend the urgent treatment centre. But I can assure you there is very detailed consideration being given to how we can reopen dentists as soon as we can. The vulnerable people we are very aware of. Government is working closely with the parishes, the charities, to make sure that none of these fall through the gaps. And I think that is the value of a community like ours on an island, that we trust we can establish contact with many people who are known between all these agencies. But as the Chief Minister has said in his speech, we recognise there are people who might just be stoically grinning and bearing it, and we have to search those out, pay special attention to those. We do recognise that, and the efforts of those working in that area will be directed in that way. Thank you.
Can I add anything?
I just want to just to support what Richard has said, but also we must remember that dentists and dental surgeries are businesses, and they employ people. So I'm keen to see a solution so dentists can reopen and provide the support it's needed. It might be a good idea to start by extending the treatments available at the hospital and move from there. So I'm with Richard, and from a business point of view, the sooner we can get our dentists open, the better, and I just hope I don't get a really bad toothache in the meantime.
Okay. In relation to the question on the Nightingale, Julie, so yes, we are giving some thought to what the handover process will be for the Nightingale, but I can't give you any further information on that right out of today. We will, of course, clarify that in due course and in advance of when that handover process takes place. part of it is obviously driven, which at the moment everybody is on schedule for, is making sure that the build and the fitting out all happens on time, and all the rest that goes with it. Okay, right. Harry, you've been sitting there very patiently, so 3 questions from you. If you can give us the 3, we'll try and divvy them up.
Yes, I'll answer my 3 questions now. Thank you very much indeed, everyone. My first question is regarding the more time that people can spend outside the home, as you said, from up to 4 hours from 2. What direction is being given to police officers on that? Because I imagine that might make it a bit more difficult for them, especially for people who may go in and out of the home more regularly. It might be more difficult for them to police that and make sure people are kept safe. My second question is the balance between people being asked to go back to work with children going back to school. Obviously, we've heard that children in the schools are currently set to be closed until the 1st of June, but it may be the case that some people are asked to go back to work earlier than that. What protections are in place for workers who are told to go back to work, but then not able to look after their children as they've been doing recently? And my third question is just to clear up testing. Obviously, regarding the news that's been given over the last couple of days, a lot of the response that we've been given is, I want that reassurance, I want to be tested, I want to know that I'm okay. We've heard the phrase island wide testing used before, but with the antibody test that's starting this weekend, we know that 1,500 people or so 500 households are going to be tested and then more regularly. Will everyone be tested at some point, or can you say that a lot of people won't be tested? They want that reassurance. Thank you very much.
You okay to take that one, Richard? Yeah. Okay, right. So, Harry, what we'll do, Lyndon will pick up the question, if I've understood it, which is the balance between people going back to work and the issues around schooling. Richard Reniff will pick up the query you've just raised about testing. And then I'll pick up the, at the end of that, I'll pick up the issue around the 4 hours and the enforcement. Lyndon.
Thank you, Harry. I think it's important that as we get further into the soft lockdown, then into the soft opening stages, perhaps the work we're doing to open the economy and opening the schools will sort of align a bit more closely, because it is they both support each other. The advice is still to work from home as much as possible, and I know that the Education Minister is working on how more children can return to school safely, but there is a logistical challenge, a capacity challenge due to the physical distancing that's required. But I think we'll see the work streams coming closer together as we get a little bit further down the road.
Yeah. Richard?
So, Harry, on the question, will everyone be tested at some point? That's a point that may be in the future, but at this time it's not really helpful. The tests that will be conducted from Saturday onwards on the 500 households will show us statistically what penetration the virus has made into the island, but our best estimates at the moment are it's no more than perhaps 5%. But we'll get that figure more certain by the end of next week. So a mass testing of people isn't going to help too many. But once in weeks to come, that will certainly remain under consideration. And once we get a greater flow of test kits in, and once it becomes suitable to do so, then it may well be something that's introduced, but it's not under active discussion just at this moment. And we must also consider that the fact that somebody is tested positive, meaning that they've had the virus, there's some doubt that is spoken about in national circles and the World Health Organization, some doubt as to whether that actually confers immunity or sufficient immunity. It seems to be the case that if you are seriously ill with the virus, then you develop a high degree of immunity. But if you've been asymptomatic, then merely having a positive test may not suggest that you have immunity. So until those issues are worked out, there's perhaps a limited need or effectiveness for wholesale testing in that way. Thank you.
I think just to reiterate, the scheme that we're running from tomorrow is a pilot scheme. So, and that will inform us then as to where we go. To come back to your enforcement principle, I think what I'd say in a general principle, we get updates pretty well at every Emergencies Council that as to what the level of enforcement has been and what the issues are, and that's and obviously the Chief of Police and obviously the Chief of Police attends the Emergencies Council, but obviously the Minister for Home Affairs is a member by way of being one of the competent authorities, as we call them. So so my understanding is at the operational level, these issues around enforcement are considered in terms of as that advice is all brought together. But what I will just say is that to date, as we've said, islanders as a whole have generally acted very responsibly. They need to be congratulated, and what we're asking them is to carry on the way they've carried on. If everybody continues to act responsibly, respects the physical distancing, then we can carry on doing things, and it means it makes it easier as well to continue the easement process that we go through. If we don't, that's actually could be one of the factors where things get out of control and then we have to rein back. Right, now time-wise, I think we've got time for one more question each, if I'm right. So so we'll go back to the same order. So we'll do Gary, then Tom, then Elodie, then Julie, then Harry, and then I think we then wrap up, if that's okay. So Gary.
Because my questions, I know you can do really short answers with, a cheeky one to each of you. Economic Development Minister, could opening up inter-island travel be the starting point to reconnecting Jersey? Health Minister, the second wave of the Spanish flu was the big killer. Are you worried the second wave is actually the one to be wary of? And Chief Minister, first of all, your own reports show there have been no overall excess deaths so far this year compared to previous years. But when you just look at April, it's gone up by more than 50% compared to last year. What's your current excess death forecast? Thank you.
I guess I'll go first, Lyndon second, and Richard third then. We're not speculating on, shall we say, future death toll and things like that. It depends on so many factors which can change at any point. Hopefully what we're now seeing is that we're actually putting as much data out as we can do, which hopefully adds to that transparency that people have been wanting, or the desire for more information. But what it does also show, and always got to be careful with percentages versus numbers, so relatively lowish numbers, an increase from 2 to 4 is a doubling type of thing, but it's still only an increase in 2 as a principle. But what it does demonstrate is that through the course of a year, obviously there seem to be some patterns that come through in terms of, it's a horrible expression, perhaps normal levels of death that take place during the course of the year. What we've just got to keep an eye on is those fluctuations, and then obviously as coronavirus spreads through, how that impacts on that outcome. Lyndon, flights, Guernsey.
Okay, yes, thank you, Gary. Of course, the big challenge to travel, whether it be inter-island or from anywhere else, is the 14-day isolation period. As long as that's in place, it's very difficult to travel between Jersey and other destinations. It's also been identified that could present still a significant risk if we were to open our borders too soon. But when we get to the stage where we can reduce that isolation period, then I'd really want to see our tourism business start up again, and obviously in a safe and careful way. I believe that's probably been the hardest hit sector, not least because of the nature of the business, but simply because of the timing that the pandemic hit us. And we are, Ports of Jersey, the Chief Exec, Matt Thomas, and his team at the Ports of Jersey are doing a tremendous job in talking to our airline partners and our shipping partners and all the stakeholders who are all keen to get their businesses back up and running. So those conversations are ongoing. Islanders might have seen an announcement by British Airways yesterday that they could be pulling out of Gatwick and focusing all of their flights from Heathrow. And at first thought that might have caused some concern, but we do have very strong links with EasyJet from Gatwick, which we hope to rebuild again as we come out of this. But British Airways see us as a very important and long-standing partner with theirs, and I see this as perhaps an opportunity. If British Airways were to operate solely from Heathrow, I feel very confident that we would see new Heathrow links start up much sooner than had they stayed at Gatwick. So some reason to be positive there.
Richard.
So yes, Gary refers to the Spanish flu, and when I was a youngster, and that's a long time ago, I well recall members of my family tenderly referring to a family member who lost her life in the Spanish flu aged 19. So it was a tragic incident, a tragic time. And yes, of course, I have to worry whether we would have a second wave, which we might not be able to control. And that is why the government is doing the work it is to ensure that that risk is minimised to the extent we can. But it remains a risk. We're not dealing with flu. There are differences, but it remains something that shows our vulnerability as societies around the world. But we're 100 years on from Spanish flu. We've got better scientific understanding of viruses. We've got better treatment options. Our hospital is well prepared, and our medical staff have excellent skills to cope with so much of what may be ahead of us. We hope not. We don't want it to get there. But these plans that we have are designed to address the health issues of the island, and at the same time ensure that we can work our way back to a normal way of living. Thank you.
Okay, Tom.
Thank you. There are 129 available beds as of today in the General Hospital, and we're about to have another 180 beds available in the Nightingale Hospital. Should we be reassured about that, what seems like a huge capacity, or alarmed that we could have a majority of patients taking up those 300 beds at a point in the future?
Do you want to take that?
Yes, I can try. I think we can be reassured that the island has, through good planning, got that capacity. But let's not say that it will never be needed. It would be great if we didn't need to use the Nightingale, in the sense that we didn't have that level of COVID patients who needed treatment. But it's right, we prepare for it. I hope that answers your question. That's what I would like to say.
I think I'd only add that, which is, I think somebody asked me that question at the last press conference, which is also around flexibility, isn't it? It's, it gives us that flexibility within the health system to react or act accordingly, depending how things change over the next few weeks. And that is important.
I'd just like to return briefly to a previous question that I didn't fully get to. We did hear a mention of the R rate for Guernsey of 0.85 earlier. Is there a rate for Jersey? You mentioned that it would be low at the moment. Has it been calculated? And if it hasn't, will there be a calculation coming up?
So this would be calculated very regularly, daily, and I'm not sure I've got recent days figures, but I did inquire, and I was told that some days ago our rate was below 1, similar to Guernsey.
Okay.
Thank you.
All right, Elodie.
Yes, I think it would be probably one for the health minister. Does the government have the legal power to enforce vaccinations? And if not, has such a law change been considered in line with the UK?
My understanding is that we don't have the legal power to enforce vaccinations. I'm not aware of what the UK have done, so I can't comment on their measures. at the moment, I've not been advised we're considering any sorts of change legal powers, but it may need to come to a case where we do consider that. But I would hope that, when vaccines become available, islanders will voluntarily come for their own protection to receive that vaccine. I'd hope we wouldn't need to legislate for it, which is the position with all the other vaccines we offer. We have a very good take-up in Jersey. The island responds well to appeals to keep our immunity levels up, and I hope the same may happen with COVID.
Okay, Julie.
This one may be best answered by Senator Farnham. You've said by the 12th of May, restaurants and cafes may be able to offer outdoor seating as long as they're socially distanced. But what protection will there be for staff in kitchens, waiting staff who won't necessarily be able to socially distance? Surely they're going to be more vulnerable.
Well, we're seeing a lot of food outlets now offering an important takeaway and delivery service to islanders. They've been doing that for some time. They've been working with new systems in their kitchens. Obviously, it's challenging, but I think there has to be some leeway there, and Health have issued guidelines. But for example, when we talk about reopening our fresco areas, staff will be required to wear masks, and there'll be strict guidelines. Those are going to be published as soon as possible, so that the businesses involved have as much time as possible to be able to prepare for that.
Yes, Julie, can I just clarify what we are anticipating, and it's, I do emphasise the anticipate, is from the 12th of May that we can move to the level 3. That is subject, as we've said, for all the levels going ahead as well, the final advice that will come through from the wonderfully named STAC group. But the crucial thing is when we go into a start of a level, it doesn't necessarily mean that the entire level will be implemented on day one. So it's not necessarily the case that from the 12th of May that all restaurants could open with an al fresco area. And I think the emphasis around that, and Senator Farnham's correct, it's all about this balance between we want to move at pace, but we've got to do it with the advice we get, and that's based on the data we receive. And also, is where appropriate, if guidelines need to be produced, they need to be produced and then given to the relevant sector sufficiently in advance that they can prepare. So I just want to clarify that, but we are.
Can I
Yep.
just add something? No, I think it's important to say that it wouldn't be wise to allow every al fresco area to open on the 12th of May. There has to be a staged opening. Guidelines will be issued. And so we want to open it in a manageable way, just to protect people, so everybody doesn't rush out on the 12th and fill up all of the al fresco eating areas. So it's important we do that. But having said that, as you would expect, I'm keen to get these businesses taking money again and providing some opportunity to eat out with their families. But of course, we must do it sensibly.
Okay, Harry, final question.
Thank you very much. Slightly different final question, if I may. Deputy Chief Minister, you said in the State Assembly earlier this year that a short list of 2 or 3 new hospital sites would be published early April. Haven't heard anything yet. Has there been a delay? Why has no shortlist been published? Has the project been delayed? I think it's still important. Obviously, I fully understand the situation we're in, but I think it's still a very important subject to cover, especially if we've heard in scrutiny recently that it's still a very high priority for the government.
Yes, it absolutely is. And there has been a very small delay simply because of the resources we have had to dedicate to deal with the COVID-19 pandemic, as one would expect. But I'm pleased to report that the Political Oversight Group continues to meet. We have met on a number of occasions, and we are forging ahead with the project. It is important. I want to reassure islanders that it remains a high priority project for the island. We are going to proceed although we have been delayed by probably about 4 weeks on the announcement of the shortlist sites. But watch this space, information coming, I would anticipate sometime over the course of the next couple of weeks. We'll be in a position to get back onto a schedule. Of course, this might mean that we see a month or two on the other end of the programme, but that I think is unavoidable. The important thing is we get on and we build ourselves a really good hospital that we can all be proud of.
Can we expect a shortlist this month then?
Oh, it's May now, isn't it? Yes. I thought that was a bit of a big ask. Yes, I think that's very likely.
Thank you.
Okay, can I just say to everyone who's been listening and watching on Facebook, thank you very much for taking the time to listen to us. I hope it's been informative, and basically stay safe, have a decent and pleasant bank holiday. I haven't looked at the weather forecast, so fingers crossed, at least for some of it. And can I thank the journalists for their questions? And obviously, we look forward to doing the next press conference next week. Obviously, it's a shortened week next week, so we've just got to get the time in place. But thank you very much. And at that point, we close this conference.